Well, as you know, October is Breast Cancer Awareness Month and a time for women to really think about getting mammograms.
That's right. Plastic surgeons of Lexington specialize in reconstructive surgery for women who have been affected by cancer. Dr. Joseph Hill and Dr. Michael Lynch are both here. Doctors, welcome.
Thank you. Thanks for having us.
Let's talk a little bit about it because, you know, sadly, women do seem to think of their femininity and sexuality based on their breast sizes. And so when they have to undergo something as radical as a mastectomy, it can be devastating.
Absolutely. You know, the two of us do a significant amount of breast reconstruction in town here, and so we see a high volume of patients. And one of the common things that helps them get through the entire breast cancer process is being able to undergo reconstruction to give them back their body image that they so much desired before having the mastectomy.
Right. But the main thing to keep in mind, though, is early diagnosis. So we can get to that recovery period. We got to whip this thing first, right?
Correct.
Absolutely.
Correct.
And that's what this whole month is about, you know, breast cancer awareness. You know, we need to get people, you know, having routine mammograms once a year for screening purposes.
So when we come to you at the end of our cancer treatments, what exactly do you counsel your patients to choose? Because there is augmentation and then there's also lift too, isn't it?
So you actually come to us in the beginning of the sort of cancer treatment protocol. We're involved from the very beginning, and we actually spend quite a bit of time with the patients because what we do for them is not an overnight thing. It takes, you know, 6 months at least to do. And so we're very involved with the patient from the very beginning, and we find it very rewarding to do this kind of work. We take a lot of pride in it.
Now, you guys brought some things with you right here. What are we looking at,
Well,
guys?
great. That's a good question. So we brought two of the most common and most recent silicone implants that are out there to show you the difference. This is an anatomically shaped implant, so it holds its shape, and therefore this is a great option both in reconstructive efforts but also for cosmetic breast surgery. And this is your more classic round silicone implant that we use a very high volume of in our cosmetic side of our practice, as well as reconstruction, but for breast enhancement surgery as well.
So if I've undergone breast cancer surgery and reconstruction and say I'm going for my next mammogram, will it mask any potential future cancers, or can they still, through mammography now, see through these particular implants to get and give me the proper diagnosis?
So if you've had breast cancer before and you've had a mastectomy and then reconstruction with an implant, you don't need a mammogram in the future. It's all physical exam.
Oh, really?
However, if you've had a breast augmentation for breast enhancement, which we do a lot of, and so we see this quite a bit, the implant is not damaged by the mammogram itself.
And you can still do a traditional mammogram with the implant in place.
And be able to see.
And see everything.
So that thing
fine.
can withstand the mammogram.
It can.
Okay.
I don't know. It gives it a good run for
I've
its money.
just heard.
It gives it a good run for its money.
You don't want to hear a pop. Okay, so Plastic Surgeons of Lexington is located at 1401 Harrodsburg Road, Suite B. That's 488. And they're open Monday through Friday from 9 to 5. A consultation, call 276-3883. And you can also check them out online, plasticsurgeonsoflexington.com. Thank you, gentlemen, for coming out.
Thank you very much.
Good job.
Hang out right there while we take a quick look at the forecast.
Yeah, Tom Ackerman standing by at the LEX 18 Storm Tracker Weather Center.